Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about asymptomatic transmission and a recent meta-analysis that just came out looking at this. But before we talk about this, one of the frustrating things that's happened over the past 8 or 9 months is that science doesn't really seem to matter anymore, and that expert opinions seem to be the driving factor for people's attitudes. For me personally, while I consider myself an expert, I am in almost every case merely the messenger. I give the research. I always consistently give the links to the research that I'm talking about. So if you don't like what I have to say, you can go read the research itself. For 20 plus years, this has been the important part of what I've provided, because much of what I say flies in the face of what most people believe or have been led to believe, and it's important for me to be able to back up what I have to say. Certainly, you could read the research and come to your own conclusions. I'm happy to have discussions on that, but not a discussion based on what the New York Times or this expert or that expert said, because it's their interpretation of the data rather than your interpretation of the data. And there are a couple things with the whole COVID epidemic that has that has created probably the biggest things, two or three. Asymptomatic transmission, which then has to do with masks as well, and fomites. So like the fact that every surface on the planet is now contaminated with enough virus to make you deathly ill. Not going to talk about in this video, but it's one of those things that the science completely flies in the face of what most people believe. Even the CDC says that asymptomatic transmission is responsible for 50% of transmission of this case. There's just, like, that's their interpretation. The studies that the CDC references are modeling studies, so not real world studies, as opposed to this study that was just published. And the beauty about this is it's a meta-analysis. When we talk about a meta-analysis, it is looking at multiple studies, finding commonalities, looking for what's good research and what's not, and coming to a conclusion based on lots of evidence. So in particular, this study looked at, and it was looking at household transmission, looking at 54 different studies, 77,000, almost 78,000 people. So a large pool of people to look at. And they looked at household transmission, and these numbers are probably a little surprising to most people, but these are very consistent with what we've seen all along. I've done previous videos on household transmission and asymptomatic transmission, and we're just not seeing what people think we are. So generally, household transmission, I will usually say it's under 20%. That means somebody living in your household who gets sick, how likely is it for the rest of the household to get sick? And it's not 100%. It's usually 20% or lower. In this particular review of all of them, it's consistent with that. It found that overall household transmission was just under 17%, so 16.6%. Still a large percentage, and the reality is that this is how it's transmitting, is in the households. So stay-at-home orders, ironically, increase transmission of the virus, because most of the transmissions occur in the household, not at sprouts. So when you force people to come back to live within a household, you're actually increasing the transmission, the R number of the virus. So so overall, when they looked at everything symptomatic versus asymptomatic and pre-symptomatic, the symptomatic was responsible for 18% spread in the household. The asymptomatic and pre-symptomatic, 0.7%. The authors basically conclude that it boils down to zero. Like asymptomatic transmission happens, but it's relatively rare, and it is not what is driving this infection. But we're acting like it is. We're afraid of walking by somebody in Sprouts or Walmart because we think we're going to get, And yet the evidence clearly does not suggest that that is what's happening. And this is yet another study that points to the fact that asymptomatic transmission is just not really a thing with COVID. As always, the experts will tell you that it is, even the CDC says that it does, but the research suggests otherwise. A couple interesting things with the study they looked at, and some of this makes sense. So when they looked at transmission within the household, households with only 2 family members, the transmission was higher. That makes sense. If you got a family of 6 versus a family of 2, it's probably more likely to spread in those 2. Spouses were the most likely to transmit to one another. Again, makes sense. They're going to be sleeping in the same bed. They're going to have more of the same impact. Intimacy is higher among spouses than it is family members. And so those are the things, like one contact household, so basically 2 people live in the household, and spouses were the highest likelihood of transmitting the virus in the household. As always, I will post a link to this particular review, this meta-analysis, in the description. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel. And again, the only thing I can please ask you to do is look at the research for yourself. If you don't understand it, kind of read through some of it. You can get the conclusions. The abstract is very easy to read through. But understand, come to your own conclusions. Stop getting your information from secondhand sources and get them from the original research, which does not support what the vast majority of people are fearful of. What it does continually support is this need to support our own health, because nothing is more important than taking good care of your health.